Hi, I'm Katie Dietz, Marketing Coordinator at Nurses PRN. In this month's video blog, we are going to discuss the topic of infertility. When you and your partner discuss the possibility of having a family, the thought of this dream not happening probably doesn't cross your minds. Unfortunately, many couples throughout the world struggle with infertility, and sadly, it seems to be a silent struggle. April 20th through April 26th is National Infertility Awareness Week. And to honor this week, Kate, an RN at Caldas Center for Fertility, Surgery, and Pregnancy, will further discuss this issue.
With this being Infertility Awareness Week, I'm so glad that we are making an awareness of it. I think a lot of people, don't talk much about it, and they used to not talk a lot about it. And there's a lot of emotions that come with it, fears. There's excitement. It really is a roller coaster of emotions, and I'm so glad that we're able to talk about it now, and that women can get to a point where they can express all of that and ultimately reach their goal. So infertility is, the diagnosis is different for every woman and every family. But for some, they say up to 1 year of trying and not having success. But that doesn't mean that you necessarily need to wait that long. There's different causes for it. So it could be, you're not ovulating regularly, or you're not ovulating at all. You're not getting menstrual cycles. You could have endometriosis, tubal factors. If there's possibly a fallopian tube blocked, there could be male factor, and that is one of the biggest factors with infertility is the male factor. So, and it could be both. It could be unexplained. So I really think it's important to, if you are having a hard time, and like I said, it doesn't necessarily need to be you need to wait a certain amount of time. It's what's best for you and your family, and finding the right doctor is the first step, I would say. I would say finding someone that you feel comfortable with, that you trust, that you can put it all out on the table, and who's really going to be a good detective for what is the reason here. So doing a thorough exam, getting a really good history, not only on you but the patient and the family, possibly ordering labs, doing an ultrasound, checking to see if those fallopian tubes are open. And for the guys, there's testing there too. There's semen analysis to see, are we going to be able to conceive naturally? Do we need assisted, help, like with insemination, things like that. And then therefore going to, what's next? What kind of treatment do I have? What do I have to face? I think education is the first step. I think knowledge is power in this situation. Knowing more, understanding your body, understanding, how that process works, is key. And then going on from there, you might need oral medication, or medication therapy to help with hormone balance or helping with ovulation. You might have a metabolic imbalance, and that will help, doing assisted, like with the inseminations like we talked about. Sometimes we need to add those in there. Sometimes surgery is needed. Sometimes, if we do have endometriosis or a blocked fallopian tube or a uterine anomaly, we need to go in and help with that too surgically. And then there's the IVF, of course, too, that we sometimes have to go to as well. So I've had the privilege of working in an OBGYN office and with a focus in infertility, and have met wonderful couples and have gone through that journey with them. And it definitely is a roller coaster, but ultimately seeing them reach their goal and bring home their baby is the best feeling ever. So if I can give any advice to those women and families that are just striving to be parents, it would be to do something about it, and don't be afraid to find someone that's going to help you and you're not alone. You know, there is support out there. We support you, and we want to see you become a mommy and daddy, and we're so happy that we get to see that happen. So.
We hope this video encouraged you, a friend or family member, to seek help for infertility. As a patient of Dr. Caldis's, I can honestly say he reignited my hope for a family. During my first visit with him, there was an answer and a solution to my infertility struggle. There is hope. To learn more about the Caldis Center for Fertility, Surgery, and Pregnancy, please visit caldiscenter.com or call 920-886-2299. See you next month.